Good evening, all, and all the participants. It's my privilege and honor also that you all have taken your time to join us. I, Vinod Misra, on behalf of Precia Pharma, welcome you all for joining this webinar and insight into diabetes in the current pandemic of COVID-19. It's also the platform where we can salute the medical fraternity for their endless efforts and their contribution in saving the precious life during this difficult time. We salute all the fraternity. Today with us, our eminent speaker is Dr. Biplab Bandopadhyay from Raipur. Dr. Biplab Bandopadhyay, to introduce him, he is a very big picture, but his introduction is very small. So we will come to know that more when he will start his deliberation. To start with, Dr. Biplab, he is a MD medicine as well as he is a DM endocrinology. He is consultant physician, endocrinologist and diabetologist based at Raipur. He is thyroid, diabetes and hormone care. That is his institute which he is running based at Raipur. It's my privilege and honor to have you, sir, as a STEM speaker for today's webinar.
Thank you.
Over to you, sir.
Good afternoon, everybody. We will start today's discussion, managing diabetes in the current pandemic of COVID. As you all know, that COVID is a big endemic engulfing the world. So before discussing COVID-19 pandemic, we have some disclaimers that our resource sources are WHO, ICMR, and some published evidences. Discussion after this seminar we will do is not authentic and not validated. And since science of COVID-19 is rapidly evolving, including the citation, non-article subjects has also been included for interpretation, and clinical judgment of the physician reigns supreme over the content which is available. This online dissemination of scientific information is new normal because recently information of technology and MCI has allowed the doctor to write e-prescriptions and WhatsApp to help the people who cannot reach doctors and get their medical help. And COVID-19 as an emerging, rapidly evolving situation. Keeping all these in view, we should salute the Dr. Li Weilang, 35 years old ophthalmologist of China, who first noticed the signs and symptoms of SARS in Wuhan, and he notified it. Unfortunately, this doctor died of COVID complications. We have all salute to him. This is the diagrammatic picture of coronavirus, which is like corona on the head of a princess. It has got protein spikes and very small amount of RNA material. We have come across SARS virus, MERS virus, and recently we are encountering the COVID-19. Hundreds and thousands of cases spread in China and all over the world. In next slide, I will summarize the things that different coronaviruses which are present, and Middle East Respiratory Syndrome, MERS, and SARS, severe acute respiratory syndrome, we have also noticed. But this COVID virus is a little different. It is more aggressive. Its transmission is very quick and rapid, and ill effects are also severe. So the mapping of 2019 COVID virus, COVID-19, first in December 31st, 2019, WHO informed the outbreak of pneumonia of uncertain cause in Wuhan city. The first reported case was on December 8th. Then the virus was named as per its genetic structure, and it has spread all over the world from Wuhan, China. Next, we will discuss that it is a basic public health problem which presents like simple flu or a viral fever. After 2 to 7 days of the fever, dry cough may be there, mild breathing difficulty. The fever can be severe, may go up to 100, 102, 104 degree. Some GI issues can be there with diarrhea. Dry cough is there, cough is not wet, and sneezing need not be present. So 4 main features, coughing, fever, pneumonia, and shortness of breath, is present in the presentation of COVID-19. So we have to differentiate the COVID-19 infection from other flu and simple cold. Next, we can see that there are some differences. So most important job as on today is my patient on phone are asking that I have some fever, malaise, I have some dry cough, but no fever. What should I do? This is the time of consoling the patient and making them confident that nothing is wrong with them. Most of the patients, 80% of the patients will develop antibodies of COVID-19 and they will not manifest in as severe cases. So we have to differentiate between cold, flu, and COVID. Important point is the coronavirus has a incubation period of 2 to 14 days. But cold and flu has small incubation period, 1 to 3 days, 4 days. The symptoms with corona are gradual. With the flu, it is usually abrupt. Within 1 or 2 days, congestion, nose block, etc. will appear. The symptoms can last up to 1 or 2 weeks in cold. In flu, it can last up to 3 to 7 days. And in coronavirus infection, it can be up to 2 weeks, 3 weeks. Running nose is less common with coronavirus. If there is running nose, if there is sore throat, then we can reassure the patient that it may not be corona. So don't worry about it. Take some symptomatic treatment and wait for some time. With cough and respiratory distress, it is important that if the patient is having, after 7 days of fever, cough and respiratory distress, we should better advise the patient to get tested for coronavirus and should go to the definitive centers where the tests are being done. Then we will discuss about diabetes and coronavirus. Most of the diabetic patients do not have extra risk to suffer from coronavirus. If your blood glucose levels are fairly controlled, then you may not be infected with coronavirus. But if your blood glucose level are not controlled properly, then the severe complications you can develop. The situation report of past 24 hours, we can see that no new country has developed it. And it has spread all over the world except few African countries where probably the rate of other infections or tuberculosis is rampant. In India also, since we are getting BCG vaccination, therefore the severity of the cases may not be very severe. But we have to wait, and no early declaration or complacence can be made. So till today, more than 1 crore people are affected. In India, about 2,000 patients are diagnosed and nearly 60 deaths has taken place till today. After 5 p.m., new bulletin will come. Definition of the patients who should be kept for surveillance. Surveillance case of severe acute respiratory illness is a person with a history of fever and cough requiring admission in the hospital. And clinicians should also be alert of possibility of immunocompromised state, or and any person has an international travel 14 days prior to the symptom onset, or a healthcare worker which is working in an environment where acute respiratory illness patients he is taking care of without any relevant history of travel, or a patient who develops unusual signs and symptoms, especially sudden deterioration in the health and respiratory distress, they should be kept in surveillance. Next, please. Next, we discuss that the patient who should be admitted. Next slide, please.
Yes, sir.
Close contact should be defined as, first we describe the surveillance and then close contact. Close contact is healthcare professional, including doctors, nurses, sweepers, and ward boys who work in the same environment, or a close contact in office or in a school sharing same enclosure, or traveler with the COVID-19 patients in any class of travel. It may be train, it may be bus, it can be auto, or it can be a aeroplane, or a person who lives in a house with a COVID-19 patient. So we have to differentiate between surveillance patient, close surveillance, and close contact patients. Next, please. The clinical characteristic of 138 hospitalized patient coronavirus infection. It was published in JAMA February 7th. The mean age of the patient was 56 years and 54% were men. 29% of the patients were hospitalized. They were healthcare personnel. And hospitalized patients to patient transfer took place in 12% of the population. Common symptoms included fever, fatigue, and dry cough. Lymphopenia, that means absolute lymphocyte count less than 800. That means if a person having total count of 10,000, his absolute count, if it is less than 800, or there is discrepancy between polymorphs and lymphocyte ratio. If this ratio is less than 1:3, these patients should be suspected in our clinical practice. There can be prolongation of the performance time, or can be elevated lactate dehydrogenase, LDH enzyme levels. Further features, if you see the clinical characteristic of the patient, next please, our chest CT showed definitive pneumonic patches, bilateral, without explaining any reason. Next please. The patient who were treated in ICU, median age was 66 years versus 51 years in non-ICU patient, and most number of the patient had comorbidities. 72% of the patient had comorbidities. Those patients can be diabetic, they can be of cardiovascular disease, they can be of renal problem. Anorexia was present in most number of the patient. 2/3 patient showed anorexia. 11% patient required high flow oxygen therapy, and ventilation was supported in 47% of the patient. So it is a big number that ventilators are required, and we are also reading all where that ventilators. They are very much required at this stage. The presumed hospital-related transmission while COVID was suspected to be 41%, and 26% of the patients required ICU care and mortality was 4.3%. Luckily, in India, today mortality is about 0.4%. And this is a low mortality. And we should hope that we should be tide over this crisis. Next, please. So a lot of protective measures, which already you know and has been discussed in many fronts. Wash your hand, soap, sanitizer. If you're using tissue paper, dispose it properly in closed bins. Cover your nose and mouth. Yesterday only directive have come that government has announced that people who are going on street, they can cover their nose and mouth with simple handkerchief or a simple mask. Please leave the N95 mask for doctors. I'm telling in public platforms that please do not use N95 mask. They are in short supply and therefore you should not use it. So that if someone needs it really, they will not get it. Distance should be maintained and hand washing techniques have been explained thoroughly in different videos. I hope you know it and you can demonstrate the patient or you can tell them. How to take care of yourself. This is very important. Healthcare personnel should know that how to take care of yourself and carry on your duties as a frontline soldier. Take all preventive measures that you are taking about community, such as keep washing hands frequently, including before and after home visits. Carry your own soap. Don't use common soap in the hospital and use your own sanitizer. If you're visiting an accompanying person of a suspected case, make sure that your mouth and nose is folded with a mask and a proper mask. If you are conducting community meetings, then also it should not be of a group of more than 10 to 12 people. They are segregated at minimum 1 to 2 meter distance. Maintain safe distance in crowded area, or if you are in community service, if you are going in a crowd. Even when you should inform about preventive measures and support to everyone around you. Self-monitor yourself, signs and symptoms, and report to the proper authority. Ensure that you continue to undertake tasks related to care of pregnant women, newborn children, postnatal care, breastfeeding and nutritional counseling, TB and NCD. All those workers should take care of themselves. Remember, older people are greater risk, so special care for visiting non-COVID patients also in homes should be taken. Continue to pay specialized attention to the marginalized section as it is a routine practice of a doctor. Reassure the healthcare workers about their signs and symptoms and tell them do not take any risk because they can only save the humanity from this big disaster. If you say some words about diabetes and COVID, it was a big problem in Wuhan experience also, in most of the world. The diabetic related healthcare problems are more severe. It has been seen that no extra risk of diabetic ketoacidosis and hypoglycemia in the COVID-19 infected patients. Type 1 diabetes patient may go in diabetic ketoacidosis, and viral infections which increase the inflammation, tissue edema of people is also caused above target blood glucose. So always keep the blood glucose under control. It should be less than 180. If glucose control is poor, you can advise your patients on telephone, the proper medicines and insulins, and complications can be checked. The consideration for the patient is control your diabetes properly and monitor your blood glucose frequently. Good diabetes control is the only method by you can check the superadded bacterial pneumonia as well in diabetic patients. In coexisting heart disease and kidney disease, their cardiac and renal condition should be stabilized. Nutrition is very important and protein intake should be sufficient. Vitamins can also be taken. Exercise has got important role in immunity. If patients are healthy, they can take their exercises without going to gymnasia or swimming pools. It is important to take influenza and pneumonia vaccinations. If the patient was taking, if it is due, 1 yearly vaccinations are usually taken. If it is due, you can take now. In a study by Wang et al., they have shown that tight blood glucose management was very important in Corona 2019. It was reported that overall proportion of diabetic patients were 5.3 to 20%. Due to compromised innate immunity response, diabetic patients increase susceptibility and enhance disease severity following Corona-19 infection. In addition, COVID-19 patient diabetes has got much more potential to rapidly develop acute respiratory distress syndrome and septic shock. Comorbid diabetes was treated with much more intensive care admissions also. Next, please. Compared to the patient who does not receive ICU care, diabetic patients required more ICU care, 22% versus 19%. Clinical data show that mortality of COVID-19 patient with diabetic was more. Largest epidemiological investigations in China indicated that COVID-19 patients were up to 7.3%, and without any comorbidities, the mortality was 0.9%. So this is very important for the diabetic managing physicians to ask the patient to control their diabetes very nicely and very prudently. Next, please. So you can see the pre-existing medical condition with COVID, with cardiovascular disease was 12%, diabetes 7.3, chronic respiratory disease 6.3, hypertension was there in 6%, and cancer in 5.6%, and no non-existing pre-existing condition was there in 0.9% who died. So death prevention, diabetes control is very much important. As the patient age group was higher, the more mortality was seen, and that is known. Next, please. Timely glucose management for the outbreak of corona infection is urgently needed because hyperglycemia hormones are given to the patient. Glucocorticoids and catecholamines are very much needed when patient goes in septic shock and the acute lower blood pressure, and that elevates blood glucose level. So abnormal glucose variability and diabetic complications are very much concerned when the patient is admitted. Next, please. So what should the patient do after discharge? When the diabetes patient is discharged, the 4-week follow-up of the blood glucose and should be maintained continuously and properly, because we have seen that late onset of or reappearance of the corona symptoms is being seen in some of the Wuhan city coronavirus infected patients. So re-emergence of the infection should be checked by controlling the blood glucose suitably. No long-term follow-up is still available about this complication. Next, please. So timely control of blood glucose can be done with internet and smartphones, as well as following the patient by endocrinologists and diabetologists and physicians to advise the patient regarding their comorbidity and diabetes. Educational videos we can make and release e-books on diabetes for the management of COVID-19 prevention should be provided. Of course, a lot of material is available as on today. So nationwide services and resources play a very important role in controlling COVID-19 in India. Next, please. Unproven therapies. We cannot say much about antiviral drugs. The hydroxychloroquine, interferon, etc. This is different protocols for different group of the people who are treating coronavirus, and something good will evolve. About angiotensin converting enzyme receptors and attachment of coronavirus to them. It has been seen that those patients using angiotensin blocker or angiotensin receptor blocker, angiotensin enzyme blocker, they had more chance to develop coronavirus infection. But as on today, we don't have any recommendation for the patient who are already taking AC inhibitors, all pills, and ARBs, all sartans, to stop it or change to other drug. They should continue with the same treatment of antihypertensive. Zinc can be a beneficial, may or may not be. Next, please. So, few studies are going on in Goa, Bombay, Nagpur, and some systematic review of the ongoing trials, evolution of diagnostic and therapeutic interventions, and some, next slide please. One more study is going on, which is about knowledge and awareness and attitude of novel coronavirus. And we will be waiting for the result. My friends who are working at the nodal centers of government nodal centers of the healthcare of coronavirus, they are saying that many patients who are of mental health problem are very much worried and their conditions are deteriorating. And anxiety, depression, all these things are happening to them. So as a physician, we can ask them to take proper opinion from psychiatrist if your counseling cannot treat those patients. So psychiatric health care and mental health care is also very much important in this condition. Next, please. So this is all about coronavirus 19. Coronavirus has proved that we were talking about communicable disease and it is rising and non-communicable diseases are on a downslope. The coronavirus proved it wrong. We are equally affected with communicable and non-communicable diseases. Coronavirus has taught us is William Osler's quote again, medicine is a science of uncertainty and a science of probability. So probability is in our favor, we can say, and in India, if a physician thinks that we can teach our patients properly, if we manage our patient properly, and with the leadership, we will be able to get out of this tide and be successful in defeating coronavirus. Thank you. Thank you, Lord.
Thank you, sir. Thank you very much, Biplab sir, for your nice deliberation on the subjects, and I hope everybody has understood, enjoyed this. Now I request the audience also, if they have any question also, they can ask.
My
Yes.
question is, washing hand with soap is first option or cleaning with sanitizer is the first option?
I don't think there is any difference between the two because if you're having soap, the coronavirus outer film is so thin that it will go with the hand wash of minimum 20 seconds on each point of the hand. That means you have to touch every point of the hand and both the hands should be washed, even the nails, and proper method has been shown in many videos that you have to wash it properly and touching every pore of your hand minimum 20 seconds. That is as good as sanitizer. In sanitizer, there are two types of sanitizer. One is alcoholic sanitizer and second is non-alcoholic sanitizer. It is better to use alcoholic sanitizer, which has minimum 60% of the alcohol. That is the guideline.
And from neurological point of view, any neurological symptoms in this COVID?
Yeah, many patient has developed a stroke. Many patient has developed paraplegia. If you see the coming uncertain type of myelopathy, neuropathy in the patient with the COVID infection.
Yeah, good evening, sir.
Good evening, sir. Dr. Bandopadhyay is there. Please ask your question.
Yeah, regarding, is it audible?
Yeah, audible है sir. बताइए.
Hello?
Yes, sir.
Hello?
Yeah, you are audible, sir. Go ahead, ask your question, please.
Yeah, present scenario of lockdown. Yeah, it would be taken off and it should be, is it like we are expecting more lockdowns in the future, like being a professional, medical professional, how we should go about that, like?
और असल में ना शरीर में ना इम्यूनिटी क्षमता कम.
See, you are talking about lockdown. Yes, the lockdown was very
yes,
important. You know, lockdown was very important because the stopping the mobilization of the people was very important. And those countries who were lax and did not do the lockdown at proper time, they are suffering today. As Italy, Spain, England, Iran, they are suffering today. So lockdown was very important decision by the government and it was very important. Of course, the socio-economic calamity has to be taken care by the government because 48% of our laborers are daily wage workers and their food and shelter should be taken care of. We cannot profess or pre-declare any time period for the lockdown. The government has thought with a very high power committee and intelligent people that till 14th we are locked down and next decision will be taken after that only. We should not comment any very wisely about that and we cannot foresee the things which is happening.
Thank you, sir. Regarding BCG vaccine, sir.
How do you see this pandemic, will end? I'm not talking only India, but globally, as we see the news, many times it is very scary to really look at the number of people getting infected into the US, Italy, Iran. ये कैसे खत्म होगा? Any visibility of this sort?
I don't think so because climatic condition of all the countries are different. If the good summer would have come by now, then maybe the coronavirus spread would have been not that severe. The temperature studies are showing that coronavirus infection took place in Wuhan when the temperature was 8 to 9 degrees centigrade. In India, it came when the temperature was about 20-25 degrees. So it will be God bless if the temperature rises and we don't have those much severity because every country is behaving its own way. England, Washington, New York, USA, all cold, very much cold. Spain, Italy, they're cold countries. So the prognosis will be different in different countries. And we cannot say anything that what will be future of India. We have to wait 10 more days to see more number of deaths and more severe infection to come.
Thank you very much, sir. That was the answer which many of the audience really look forward for. While you were presenting, there was one slide showing that the probability of diabetic patient getting infected and the other is the same. But uncontrolled diabetes had the mortality rate of around 7.3%, which is in normal people, they are about 1.8. So why do you see this 3 times increase into the death of uncontrolled diabetic, or the mortality rather? Is there any scientific angle to this which you can comment upon?
Probably the diabetic patients are having low immunity. 70% of the diabetes in India are uncontrolled. So whatever we have done, whatever measures we have taken, most of the diabetic patients are uncontrolled. Probably therefore, and this scenario is everywhere. In USA, maybe 30 to 40, 50% of the patients are uncontrolled. China may have been lower patients are uncontrolled. So when the blood glucose is more than 200, naturally your immunity, innate immunity is low. And that is the reason that we are facing this situation.
In such situations, sir, are the physicians and diabetologists are asking their patient to manage their diabetic more aggressively, keep the, otherwise also you would be doing it. But in such a situation, are you really recommending your patient to go aggressive on controlling the blood sugar level or the glycemic levels? Dr. Bandopadhyay, can you hear me, sir? Sir, आवाज आ रही है? I think we know have we lost the contact with Dr. Okay.
Yes, sir, I feel so.
Yeah. Sir has dropped down.
Okay, आप जरा बात करिए. Dr. Vadhwa is also online. Dr. Navneet. Navneet Vadhwa sir online है, Vinod?
No, sir, he is not there, sir.
Okay.
Sir.
Great. Dr. Panchal have the question. I saw the hands has been raised. So,
sir, just to inform you that Dr. Biplab Bandopadhyay just called me. Due to power off, he has got disconnected due to internet interruption, sir.
Okay.
Sorry for that, audience, and thank you, sir.
I think we were almost done with the deliberation of him, and we were asking the question. Vinod, is Dr. Vadhwa is there online?
No, sir, he is not there because of some other already meeting, so he is not here. Sir.
I could see him online. Can you just check it? I mean, in participant, his name was there. Right. I would request audience, if you, amongst you, esteemed doctors, you have something to share about COVID-19 and how are you managing your diabetic patients or OPDs rather. Dr. Boy, would you like to comment upon that? वही सर, आप पेशेंट कैसे देख रहे हो अभी इस सारे सिचुएशन में?
Diabetes patient.
हाँ, diabetic patient and other patient, what are the instructions you are giving?
Actually, ICU patients are managed by our intensivist.
Okay.
So we have no much problem.
Okay.
We are giving only rounds only.
Okay. Okay. Dr. Panchal is there, sir.
And we have in our hospital there is.
Yeah, Dr. Boy, please go ahead.
In our private corporate hospitals, only COVID designated hospitals are there in Chhattisgarh.
Okay.
So we have no chance of COVID infection.
Okay.
But we are taking care of diabetes patients regularly.
Great. Dr. Panchal Roy, sir, are you there online? Can you say something on this? Yeah.
Yeah, I was asked. I was one question actually. If you can clarify from sir.
Yeah.
Hello. Is it audible?
Yes, sir.
I was asking a question, but if you can clarify and get back to me in WhatsApp or so. Okay. Regarding BCG vaccine, we had every Indian had a BCG vaccine done in our childhood.
Okay.
So we got a news plus and minus regarding it protections regarding the coronavirus COVID-19. So this is my question actually. So regarding, if you can clarify with the sir, and
Oh, yes.
whatever you are asking, like how we are managing regarding the management of diabetes, because right now in Warangal, I stay in Warangal, Telangana.
Yeah.
So my clinic is shut down last week. Only emergency services we are giving on phone if necessary only. And one attached hospital I go for inpatients, where we are only seeing emergencies in diabetic care. And aggressiveness, I think we are already doing same aggressive treatment for diabetes. And right now my patients 95% almost all whoever will be under my control are doing good with right now scenario. So I think immunity, the diabetes is under control. We are no need to worry about infectious diseases, because India being a major player in infectious diseases, we are tackling from ages. So right now scenario we can manage, and mortality is very less. But main thing is they are apprehensive. They are afraid about
Yes.
the present epidemic and pandemic situation. So this is my take regarding present scenario. And
Wow.
my question, if you can answer from the sir.
Sir is
Thank you.
there online. Panchal Roy,
Thank you,
sir.
Sanjay.
Dr.
Thank you.
Biplab Bandopadhyay is online. You can ask him the question directly. Biplab, sir, Dr. Panchal Roy from
Yes, sir. Hello.
Andhra Pradesh is
Yes,
asking the
yes,
question.
yes.
Yeah.
Yes, sir. Sir, regarding the BCG vaccine, we
Yes,
got few news regarding its favoring situation. Can you brief it on that, sir?
yeah. The people, the epidemiologists are seeing that the nations where BCG vaccination was continued, there the rate of infection with COVID infection is less as in India. Because till today, our children are getting BCG vaccinated. In developing countries like Africa also, BCG vaccination is a truth. In some European countries, they give BCG vaccination. But most of them, England, USA, Spain, France, they have stopped giving BCG vaccination. So one more trial is planned by our expertise doctors, that whether BCG vaccination can give a prevention from the SARS infection, because this is not that COVID will go in 1 or 2 months or 3 months. The COVID virus herd immunity will be developed by most of the people. That means 60% of the patients or 60% of the community people will have immunity against COVID-19. That is herd immunity. So this is very premature that we have not developed herd immunity. BCG vaccination can help in developing herd immunity. So since we are already
Thank you.
exposed to tuberculosis, BCG, so we are less chance to get this COVID infection. This is true.
Right. Dr. Panchal Roy, any other questions, sir?
No, sir. Thank you.
Thank you very much, sir. Thanks for that wonderful question. And if there are no questions from the audience, should we wrap up this wonderful webinar? We had one more hand which has been gone up. Any other question from audience? Okay, great. So once again, I express the sincere gratitude for all the doctors joined in this webinar. This is a very critical and crucial subject today. Across the country, everyone is dealing with. That is COVID-19 and the situation arising out of that. This specific webinar was regarding the COVID-19 and the diabetic patients. How do we manage? What are the risk factors and other information about the COVID? Today, we at Precia, we feel very fortunate. We have the intellect like Dr. Bandopadhyay with us, and he really has gone ahead and shared his deliberation with all of us. Sir, thank you very much for accepting the invitation and enlightening the audience. We are really, really indebted to you. You would like to say, sir, something before we call off the meeting? Dr. Bandopadhyay?
Yeah, I will appeal to all my physician colleagues that open your gate, open your phone for all the patients. Give a message to the society that you are available, because diabetes control, what we can do, endocrine resistant diabetes is very much important to prevent and the onset of disease as well as to reduce the severity of the disease. So controlling diabetes will be of very much importance. The COVID has told us that if you are not controlling your diabetes well, it can come in a different form. It can be COVID-20 next year also. So we should be very much aware and cautious.
Great, great. And Dr. Manoj is there in the audience and he has some question. Dr. Manoj, please go ahead and ask the question. I mean, we're just about to close, but I can see that you have some question. Dr. Manoj? Dr. Manoj, can you hear me? Dr. Manoj, are you still there? Okay. I think it's time to call off the meeting or conclude the meeting. Hemraj, Shiva, would you like to say something on the webinar? And I mean, you should thank our esteemed speaker today.
Thank you so much, sir. I think this is a wonderful session, very nicely presented and having the good question answers sessions with the audience and all this esteemed speaker, Dr. Bandopadhyay. Thanks and sincere gratitude to Dr. Bandopadhyay for attending and accepting our invitation for this webinar. Thank you so much, sir.
Shiva is also there. I think Shiva and Thakur are the integral part of this planning. So they would like to share a word or so.
Yes, sir. Sir, I really, once again, from Precia behalf, I want to thank Biplab, sir, for accepting our invitation and enlightening us with the COVID and the effects on its diabetes. And it was a real great thing that we have really got and it was a good questionnaire session also. So definitely few other doctors also have got enlightened and had their queries cleared. So I really thank Biplab, sir, and we really look forward in future to help us out in this portfolio, sir.
Biplab sir का एक डायहार्ड फैन भी है अपने साथ में, जो शोले से निकल के डायरेक्ट इधर आया. Thakur, are you there? I think Thakur, we have lost connect with him. Right. So thank you very much, Dr. Biplab, once again, and please take care and take care of all your patients. At Precia, we once again thank you very much, sir. Thanks a lot.